Thank you very much, Mr. Chairman. Madam Secretary, one area that I've been working extensively with Chairman Waxman and also Senators Rockefeller and Whitehouse on is legislation that would strengthen the federal health care quality infrastructure in order to identify and track key health indicators, as well as to develop and implement new science across the states. What this bill does that we introduced would establish national priorities for healthcare quality, and it specifies that pediatric healthcare quality is one of the first. And a lot of this legislation has now been incorporated in the discussion draft that we're talking about today. But the draft bill also contains a provision that requires the director of the Agency for Healthcare Research and Quality to work with you as Secretary to develop quality measures for the delivery of healthcare services in the United States. And I think this is an important requirement, but I'm worried about the implications for pediatric healthcare quality measures, because even though the discussion draft requires the measures to be designed to assess the delivery of healthcare services to individuals regardless of age, the section is funded with Medicare dollars. And so under the previous administration, HHS determined that Medicare dollars could not be used for pediatric measures. I'm wondering if you can comment on this and what plans the administration has to address pediatric health care quality, and what the view of the agency is going to be.
Well, Congresswoman, I think that we are convinced that Medicare can be a leader in improving quality of care for all Americans. And certainly the development of quality standards, I think, is appropriately done under that umbrella. But all Americans definitely includes children, and that is a huge priority of the country's moving forward. So there will be a coordinated effort to make sure that the pediatric standards are very much developed in terms of quality outcomes.
And do you think that can be done with the Medicare dollars, or is that something we're going to have to explore as we move forward to the final legislation?
In the discussions with our current leadership team at CMS, they are confident that we could fulfill the mandate that's in the bill right now to develop standards, including pediatric standards.
Okay, because I know you recognize the medical establishment, and of course our icon who was here, Marian Wright Edelman, yesterday. Children are not just mini adults, so we've got to develop separate standards.
That's right.
I wonder if you can talk for a minute about the administration's view on the Title VII health workforce dollars that are included in the discussion draft.
Well, I think as you look toward the future of a reformed health system, workforce issues are hugely important. And I think that a significant step in the Stimulus Act of beginning to fund the pipeline of critical healthcare workers, doctors, mental health providers, nurse practitioners, additional nursing staff. And this discussion draft, I think, takes that to the next chapter, which recognizes not only a shift in incentives for doctors to focus on primary care, but also has enhanced workforce capacity, again, with a whole series of initiatives that would provide for more healthcare providers in more parts of the country.
Thank you. One last question. One of the provisions I was really pleased to have included in the discussion draft was the idea of auto-enrollment at birth for children whose parents don't have insurance plans to put those babies in, and then 12-month continuous eligibility for children. I'm wondering if you can comment on the administration's position on that kind of auto-enrollment.
Well, I think it's been shown that the enrollment efforts vary from state to state often, and some still require a face-to-face visit. Others have various complicated forms. So what's been proven as best practices, I think, is an easier presumptive enrollment when kids show up at the hospital. Certainly auto-enrollment at the time of birth would facilitate including children in the system and make sure they get a healthy start on life. So I think that's a big step forward.
Thank you. Thank you very much, Mr. Chairman.
Thank you, Ms. DeGette. Mr. Boyer?
Thank you very much. Madam Secretary, what